Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
So today, 24th March, is World Tuberculosis Day. Now, this day is observed annually and it amplifies the urgency of ending tuberculosis, which is the world's deadliest infectious disease. Now, this year, the theme is Yes, We Can End TB. Commit, invest, deliver. And it serves as a bold call to action, emphasizing hope, urgency and accountability. And as always, I've been joined in the studio by Dr Emefa Dzide to help us have this conversation on tuberculosis. You're welcome, Doc.
Thank you.
Good afternoon. How are you doing?
By God's grace, as usual, I'm doing great.
We thank God. Had a good weekend?
Yes, please.
And how has the day been so far?
Not too bad.
Not too many patients reporting today?
No, I won't say that.
Anyway, so today we want to look at tuberculosis. You know, today is World Tuberculosis Day, so it's just right that we have this conversation. But then, as always, to start with, we want a little education. What exactly is tuberculosis? And then how is it... how can one get infected with the tuberculosis disease?
Yes, so tuberculosis, what we usually shorten to TB.
TB, yeah.
Yes, so it's a bacterial infection. Usually, it's in the lungs. So most often it starts from the lungs, and it remains in the lungs. But occasionally, it can spread from the lungs to other organs. So it can spread to the spine. We call it spinal TB or POTS disease. We can have TB meningitis.
Oh, I've had POTS disease before.
Yes.
Okay, so that's tuberculosis.
Of the spine.
Okay.
Yeah, then there's TB meningitis. Sometimes it can affect the kidney, it can affect the uterus, it can affect the scrotum. It can go to different parts of the body. But generally, that is tuberculosis.
Okay. And then how does one get infected?
So usually it's through, should I say, aerosols or something like that.
Break it down for us.
So when a person who has the active infection coughs or sneezes, so the germs or the bacteria are like in small particles that are carried out when the person coughs or sneezes. So if you are in close proximity, you are in a close area to them, and you inhale the bacteria in the air, then you get infected. So
can it be described as an airborne disease? Not exactly.
Yes, you can say that, but only if you are in closer proximity.
Okay.
Yes.
Okay. So I want to look at some symptoms and then the whole diagnosis process. If I walk into your hospital, what would make you say that, let's investigate for TB?
Okay. So usually it's if you've had a cough that has lasted for more than 2 weeks, especially if the cough is producing sputum or what you call phlegm or mucus. Yes.
Okay.
So if you are coughing for more than 2 weeks and it's producing a phlegm, sometimes there might be blood in it. Sometimes it's just a very thick phlegm. Sometimes it's yellowish, greenish, different, but it's not really just like saliva, the normal
saliva that we know.
Okay. So that's highly suspicious. Then there's weakness, loss of appetite, there's weight loss, and then there is night sweat. So in the middle of the night, they sweat excessively to the extent that when they wake up, the whole bed, the bed sheets, everything is wet. Yes. So, and there's also fever and chills, but those ones are not very specific. Yeah,
so the specific ones are the one with the phlegm,
and
then the night sweat, and then the extreme weight loss.
Yes. Not extreme per se, but it can be extreme.
Okay.
Like over a shorter period of time.
Okay. And then want to look at the whole diagnosis process.
Okay. So the commonest way we do is the sputum test. That's more or less the gold standard. So you take some of the sputum to the lab, and then they check and see if the bacteria is in there. So what we do is a gene expert test, and I think it's free because under the program it's free to test for TB.
Oh,
in the government facilities.
In the government facilities.
Yes. So once you feel you suspect it, you can just go to the hospital, our Wejagbawe Municipal Hospital, any government
hospital.
Ask for the TB department. They'll give you the bottle to take the sample and do the test.
Oh, so there's an actual department dedicated to TB.
Yes.
In government hospitals.
Yes.
Okay. Let's double back a little. We want to know, I know you mentioned tuberculosis of the spine and then meningitis, but we want to know, are there any other types of tuberculosis?
Yes. So it's primarily a disease of the lung, but it can spread. So when it's of the lung, we call it pulmonary TB. And if it's outside the lung, then we call it extrapulmonary TB.
Okay.
So as I mentioned, the commonest ones, especially in the children, you get the TB meningitis. And in the older people, you can get the POTS disease, the spinal meningitis. Sometimes you see that they have this swelling around the neck. The lymph nodes are all swollen around the neck. Yeah. Yes. Sometimes it can cause a type of hepatitis and a type of kidney disease as well, and the sexual organs too as well. But the intestines, it can be anywhere actually.
So basically, it can spread to any part of your body.
Yes.
Okay, we want to know certain risk factors. I know you've already mentioned how it can be transmitted if you are in close proximity with someone who has it and the person coughs or sneezes.
Yeah.
But then are there any other ways that it can be transmitted, and also if there are certain risk factors involved?
So risk factors are what will make you more at risk or more likely to
contract the disease.
Infection.
Yeah.
Yes. So there are certain parts of the world where the disease is more endemic or more known to be occurring, especially in Africa, Sub-Saharan Africa, Ghana.
Why is it always Sub-Saharan Africa?
Well, there are other diseases that are not prevalent here, so we don't talk about them.
But is it because of our climate?
Yes.
Okay.
It's partly because of that, but it's also because it also occurs, I think, in Eastern Europe, South America. Well, they have a similar climate, but Asia, some parts of Asia also have, it's quite common there. Yeah. So, and also if you are having like overcrowding or not enough ventilation, so a place like the prisons where there's so many people in a small place,
yes, or the senior high schools.
Yes, some of them, if there are too many students
in one dormitory,
yes, there are not enough windows for ventilation and all that. That's also a risk factor. And then people who have damage to the lungs, especially from smoking, or those who work in the mines, they are also at risk. But then the highest risk has to do with your immune, your immune system, if your immune system is strong. Yes. So especially in babies and young children, their immune systems are not mature. So they are at high risk. That's why the babies, immediately you give birth, they give them the BCG vaccine. That's against TB.
Okay.
Yeah. So the children are very highly susceptible. So please, if you give birth, maybe you give birth at home or wherever, make sure you get your child the BCG vaccine to prevent the child from getting the TB meningitis. So the low immunity, so if someone has HIV/AIDS, if they have a chronic illness, diabetes, if they have cancer, if they have a kidney disease already, or if they are malnourished, and people like alcoholics who don't really eat well and all that, they are all very highly susceptible to getting tuberculosis. Yes, and also intravenous drug users.
Please, which one is that?
Oh, like those who use drugs in the street, like
those who use the heroin and
those
stuff.
Kind of things, injecting themselves.
Okay. We want to know if someone contracts tuberculosis and it goes untreated for a while, are there any other complications that can develop from having the infection?
There's a lot that can happen to the lungs if you don't get early treatment. So as the disease progresses, there can be accumulation of pus in the lungs or fluid in the lungs, so it can obstruct and you will not be able to breathe well. Yes, sometimes there can be a rupture of the small air bags and then like into the space in between the lung and the ribs. That's called the pleural space. So there's what we call pneumothorax. So now air escapes into that place.
I'm trying to remember my senior high school size.
Yeah. So when that air comes out, it restricts the movement of the lungs for you to be able to breathe. So sometimes the breathing might be fluid. Sometimes it's air that has escaped into that outer area to prevent the lungs from expanding, and that can lead to acute respiratory distress syndrome, which could quickly kill you. It can cause kidney damage. If it gets to the brain, there could be headaches, confusion, seizures. Sometimes if you don't treat early enough, you wait too long before you start treatment, it can cause permanent damage. So there will be fibrosis of the lung. So instead of the lung to be elastic, it will become very hard and rigid. So that means for the rest of your life, your lungs cannot expand. So you have difficulty breathing. And
can that be reversed?
No. When it's fibrosed, it can't be reversed.
So what are you going to do to such a person?
They will just have to have difficulty breathing
for the rest of their lives.
Yeah, so you would see those when those things happen. You see, we have what we call COPD. So those people, they would have to like have their own oxygen canisters to be
nebulizers and all those things.
No, not
nebulizers.
Like oxygen
canisters themselves.
Yes.
Oh,
those
wow.
big ones. So they have to be on it constantly because they are not able to breathe well. And the spinal TB, sometimes it can cause deformation of the spine. It can lead to paralysis as well. So, yeah. And then if you don't treat it at all, it can lead to death. Yeah.
Okay. So, speaking of the treatment, we want to know, is this something that can be treated at home or it requires hospitalization? And even with that, what are the treatment options that are available if someone should have this tuberculosis?
Yeah. So treatment is with what we call chemotherapy with specific special antibiotics. These are not common antibiotics you find everywhere.
Over the counter.
Yes. So you can only get them in the hospital. So you have to come to the hospital, and it's treated by DOTS. That's directly observed therapy. So you can be treated at home, but you would have to have a sponsor, someone who will be monitoring you to make sure you take the medication correctly every single day.
Okay.
Yeah. So you take the medications for, I think, a minimum of 6 months.
Wow.
Yes.
And that's the minimum, meaning it can go more than the 6 months.
It can go more than
up
6
to a
months.
year or even more than.
Up to a year, sometimes more. It depends on the severity
of
and
the
then
infection.
where the TB is. If it's a spinal TB, it might take longer.
Okay.
But the pulmonary TB, 6 months is usually the normal duration. Yeah.
But it can be completely healed.
Yes, it can be completely healed.
Okay.
Yeah.
Okay.
If you come in early. Otherwise, if you get complications, some complications cannot be reversed. So the infection will go, but then the damage has already
been done.
Yeah.
Okay. So speaking of that, can we look at some long-term effects? I know you've mentioned the difficulty in breathing. That is when the fibrosis should happen to the lungs and all that. But are there any other long-term effects of tuberculosis? Even though you get treated of the infection, it can leave you with maybe one condition or the other.
Yeah. So as I said, if the damage has already been done and it can't be reversed, those are the things. Sometimes, I think I recently had someone who kept on having recurrent infections in the chest because of scar tissue within the lungs. So every year or every 2 years, she'll get a serious chest infection and she needs to come to hospital for treatment and all that. So those are the possibilities that could occur if you don't start treatment early enough. Yeah.
Okay. And then finally, before you go, we want to know if you mentioned the whole treatment process can take anything between 6 months or more.
Yeah.
But then if you're treating someone, what are some of the signs you look out for that tells you that, okay, this treatment is working or this treatment is not working?
Okay. Normally, you would have the symptoms, the cough and all those things subside. But just because it subsides doesn't mean it's completely gone. Usually within the first 2 weeks of treatment, if the medication is working well, they are no longer infectious. So they can go back to normal work and all that. But they have to continue with the treatment for the entire 6 months. By then we are very sure that
the infection is gone.
Yes, all the infection has been totally cleared. So it's important to be going for your reviews at the TB unit, and then from time to time, they'll be doing the tests to check the levels to see how well you are doing. And I want to say something about the antibiotic use. So if you don't stick with the treatment very well, and there has been what we call drug resistance. So initially we were using just one drug. Then now we had to use 2 drugs. And
Ghanaians like antibiotics too much.
Yes, now there's even multi-drug resistance. So the normal ones are not working
anymore.
Yes. So if you don't stick to your treatment regimen, these are the things that would So the normal treatment, according to what I read, it's like $25 to treat.
Yeah.
But then if it becomes multi-drug resistant, then the cost is about $2,500 to treat.
Wow, that's a huge leap.
Yes, it's very, very expensive to do that kind of treatment. So the best thing is to get the treatment early enough and stick with the treatment. Do the dots as you have been told. Normally, they have the community nurses who will come and visit you at home and make sure everything is going on well and all that.
Okay.
But you have to stick with the treatment. Otherwise, it will make it more difficult for the rest of us, because if you have a multi-drug resistant one, then what infect someone with a multi-drug resistant, then it becomes more difficult for everyone else.
Okay. But is there a vaccine or something available for the tuberculosis, or when you give it to the babies, that's it?
No, with the babies' vaccines, it lasts for about 10 to 20 years.
Okay.
So even if you were vaccinated as a baby, once you're an adult, you can still contract the TB.
But there's no vaccination again?
Oh, no, there is vaccination again.
Okay.
But normally, unless you are going into like a risky environment and all that, it's not normally given.
Okay.
Yeah, it's only routinely given to the babies.
Okay. All right. Thank you so much, Doc, for your time as always. And I mean, every time you come here, we do learn a lot about these various diseases. And today we've learned about tuberculosis. And today being World Tuberculosis Day, I think the listeners have also been enlightened. So it's not every time that you are coughing that you just go and pick up an over-the-counter medication or antibiotic. Sometimes you need to go to the hospital and get, tested, and then make sure you are being treated for the right condition.
And TB testing is free.
It's free. So just wake up, dress up, and then get to the nearest government facility and then go get yourself tested. Yeah. Thank you so much, Doc. We'll see you next week. Yeah.
Thank you.